بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. First of all, I'd like to thank our colleague in Ministry of Health and in the organizing committee to give me this chance to be with you today in a very important event of the Patient Safety Conference. So today I'm going to have a talk about a new link actually is being approached by many of the speakers now or the researchers regarding the link between the academic accreditation and the hospital accreditation and how does this impact on patient safety. If we start with with the presentation outline, we'll talk about the healthcare system, we'll talk about the accreditation role in patient safety, then the patient safety competency of the healthcare provider, and then what is the bond between the healthcare accreditation and the academic accreditation. So the most basic principles of the healthcare system, it's the link between the mindset of clinician and employees and the shape of the patient experience and patient safety. So the complexity of healthcare system, this is what makes actually the patient safety is a big challenge for everybody working within the healthcare organization or system. It actually goes around the patient care team and organization and the environment. So this what makes it very complex and very struggle or challenge for us. So the patient journey is starting from the access of the patient to the hospital until the discharge and the process or the journey of the patient, which we are the healthcare provider take the role to make their journey is safe. According to Dr. Kenneth Kaiser, he said that we will still have the adverse event because we have an environment that can encourage the environment that challenge the error prone, the high risk and the complexity. And definitely we still, in spite of having a very modern and modified technology, we still have the human being actually is running the healthcare system with all this advantage of the technology. When we talk about the patient safety, we couldn't actually go without mentioning the Institute of Medicine report in '99 and how is this was one of the big actually trigger for all the patient safety, let's say, champion working on this one. And then in 2009, there was still no a target that reached by this time. The same happened on 2017. We still have, by the Canadian Patient Safety Institute, they mentioned that they still have a preventable harm occurs every 1 minute and 18 seconds in the hospital. So the patient harm and the patient injury and incident is still it's there. So if we will talk about the patient harm in the medical education in developing country, not necessarily rich country or the poor country, but still the error is there. Still there is a burden of unsafe care. It's not unclear sometimes, even with the developing technology. Again, the lack of well-developed medical error recording or reporting system is still, this is increased the ambiguity regarding the patient safety. So if we will talk about improving the quality and the patient safety, we have to define first the patient safety, and this is the definition that's coming from more national and international attention to the patient safety. The Patient Safety Network has defined the patient safety as the freedom from accidental preventable injuries produced by the medical care. Definitely the simple definition of the patient safety is the do no harm or the zero harm. So it aims to prevent and reduce the risk and error and harm that occur to the patient during the provision of health care. So we are very precise about the patient journey when we talk about. Again, it's the complexity of the healthcare system and resulting raise the patient risk in the healthcare facilities. So we are aiming, when we talk about the patient safety, to the zero harm. Now, there are many strategies for the patient safety. So the strategies is starting by clear policies, leadership capacity, data to drive safety improvement, effective involvement of the patient in their care. and the skilled healthcare professionals. So the skilled healthcare professionals are the key to drive the patient safety and to drive the no harm or the zero harm to the patient. One of the changes, or after the error is human, and many actually of patient aims, one of them is the quality Chasm report in 2001, and one of these strategies by facing the healthcare was the health professions education. The health profession education abridged to quality. So they are talking about the professions education. We all believe that healthcare provider are the core in the patient safety journey. The rule of performance in redesigned healthcare system, actually they mentioned more than one approach or items regarding this one. So first of all, the care is based on continuous healing on relationship. The healthcare professional should provide the care whenever the patient needed in different forms in many approaches, and they have to be responsive 24/7. The second is that the care is customized based on the patient needs and value. The health professions have the capability to respond to the patient choices and preferences. So when we develop the policies and the system, we have to consider the patient preferences. The third is the patient in this is the source of control. So healthcare professionals should be able to accommodate the differences in patient preferences and encourage the shared decision making. Number four is the knowledge is shared and information flows freely. The healthcare professional should support the patient unrestricted access to their own medical information and clinical knowledge and communicate effectively and share information with patients. This is for a very clear aim, which is that participation of the patient in taking the medical treatment decision. They have to be part, and this is one of the most common standard in all the patient safety and accreditation standards. Number five is the decision-making evidence-based. We provide the best and the scientific medicine, best available scientific and standardized knowledge to the patient. Number six is the safety is a system properly. So the healthcare professionals should ensure safety by paying greater attention to the system that help prevent and mitigate the error. This is important actually to be more preventable to the error. Then number seven is transparency is necessary, and this is very important, especially when the error happened. Number eight, it needs to are anticipated. So the health professional should be able to anticipate the patient needs through the planning. Waste is continuously decreased, so the healthcare professionals make efforts not to waste resources or patient time. Patient time is one of the valuable resources. Number 10 is a cooperation among clinicians is a priority. The actually integrated system among the patient care team is very important because it really impacts on the patient experience and patient safety. Now, if we talk another approach from the Canadian Patient Safety Institute, they develop a safety competency framework because we are talking about healthcare professionals. So we have to describe what could be the competency, what could be the profession, the skills of those healthcare professionals who will carry over the patient safety journey or task or system. So they provide this framework, and this framework actually, it includes enabling the competencies that can adapted and adopted by diverse healthcare programs to design curricula to teach safety and quality for any sector or healthcare program. And also it can be also available for the policymaker, regulators, and accredited to guide the system of the patient safety. I'm going to talk now just about regarding what could be the approach to increase the patient safety healthcare professional skills. So how can we do this? As I mentioned, that this is one of the approaches is the safety competency framework that can be adapted and adopted by the healthcare system. It includes, as I mentioned, the patient safety culture, teamwork, communication, safety risk and quality improvement, optimizing the human and system factors, and then recognize the respond and to the disclose patient safety in incidents. This is actually, it's not something that is start by one and then two, it's actually continuous cycle, as you see, to enhance the patient safety across the healthcare profession. Now we will see the accreditation approach. Accreditation approach, it's one of the approaches that actually the healthcare system selected, that it can be one of the approaches to endorse, to enforce, and encourage the patient safety and to maintain the patient safety culture in the hospital or in the healthcare funds. So it's a continuous cycle between the academic accreditation and the patient safety. If we see this cycle, we can say that the medical institute accreditation, this can actually produce, or one of the outcomes is a competent healthcare provider. This is not granted, but this is what the institute or the medical accreditation aim to, and we will see one of the approach now in the coming slides. Then we will talk that later on that we will have a safe patient, improve the risk prevention activities, and accredited healthcare institute and improved quality. So that's why I put here that the healthcare provider or the competent healthcare provider, it's the main of the puzzle, the main piece of the puzzle to be completed and to be more integrated. Now, the competent healthcare provider can come from two or more than one approach. One of this is the academic accreditation. One of them is teaching the quality and patient safety to be integrated across the continuous medical education programs and education. So this is part of the to support the patient safety through the medical or healthcare provider. The first one we'll talk about it, it's teaching for quality and integrating quality improvement and patient safety across the continuous medical education. As we know that the past decade actually has been remarkably shift in healthcare delivery. Since really decades and even before the 99 IOM reports, we know that this actually shift resulted in innovation in the quality improvement and patient safety education among the healthcare provider in the medical school or even clinical or in the teaching hospital. This is fostered in part by integration the quality within their curriculum. There was actually one of the initiative, it's 5 years old, joint initiative between the Association of American Medical College and the University Health System Consortium. They give actually more than one recommendation. So one of the recommendation is to achieve quality and patient safety goal for education, medical school and teaching hospital, all this accreditation examination organization, they have to ensure the integration of the QIPS concepts into meaningful learning experience across the continuum physician professional development and the summative evaluation used for performance and certification of the healthcare professional. Number two, in order to improve the process and the outcome of care, medical school and teaching hospital, they have to expect all clinical faculty to be proficient in QI and patient safety competencies. Again, they have to identify and support a critical mass of faculty as an expert educator to create and improve and evaluate the training for the QI and PS for the student and researcher and colleagues. Recommendation number 3 is the academic and clinical leadership. Leadership is a key factor for success of any patient safety initiative. They should share a common commitment to QIPS and demonstrate a concrete alignment of the academic and clinical enterprises in a manner produces an excellent healthcare outcomes valued by healthcare professionals and the public who are the patient. Then we will talk about the accreditation, how it can the accreditation has a role to lead the zero harm. We'll talk now about the competency assessment. Another approach is the competency assessment. There is a practical guide to the Joint Commission standard. There is actually a competency program by Joint Commission, and this is a very good really references that you can go to it. And this is an assessment program should focus on identifying, verifying, validating the skill and the abilities of staff member to ensure that they meet the organization standards. This is exactly, you will find it in all the hospital or healthcare accreditation. You will find a big actually a chunk of chapters, of not only chapters, I mean detailed standards that talk about the competency and the qualification of the healthcare provider. I mean, if I talk about the national accreditation or the Saudi accreditation in healthcare, Sibahi, you will find in all the 23 chapters, always they mention the qualification of the leadership there, qualification of the healthcare provider to the details, because this is the need at this stage to really specify what could be the qualification and the skills that they need to have it instead of actually assuming that they know. That's why they mention that you have to assess, identify, verify, and validate the skill ability, and there will be a competency improvement approaches to this. If the quality of the staff skills and the abilities remain high, then it's actually likely that the quality of the patient care and the safety will also remain high. It's really an equation that has to have this two kind of equality. The following, as I said, that JCI HR standard, it's actually provide the framework for comprehensive competency program. They guide actually the HR department and personnel department leader in development the program that fulfilled three main functions that I'm going to talk about it to support the expectation of the facility and their department. This approach actually are three. First, it required the leader to identify the qualification for each position in the facility address at higher competency validation and require leaders to ensure staffing effectiveness. This is exactly, you will find many standards that is equal to them in the accreditation standard of the hospital. Require the facility to orient new staff, students, and volunteers to the organization, department, unit, area, and which they will work, and their job establishes the process, validates staff, student again. By the end of the orientation, provide a continuing education and training. There is actually more than 4 or 5 standards talking about the different categories or the different level of orientation, general hospital orientation, and then the departmental, and then the job-specific orientation. This is in the hospital accreditation standard. This is just, I'd like to show how this is really compatible with the hospital accreditation. And again, it goes all around the competency assessment or the competency of the healthcare provider. Again, the other recommendation, or actually the clarification, required the leaders to establish a process for validation of ongoing competency of the staff. And then this is to build actually the capacity of the staff. So you identify the gap and then you develop the training or developing program or actually continuous professional development in order to fill the gap, so to maintain actually the high competent skills of the staff who will provide the services. Now, if we talk about the overview of the accreditation, we know actually the definition, or it actually provides the public notification that the institution or agency, the program, meet the standard of quality and set the forth by an accrediting agency. This is usually the certificate, or this is actually the certificate that it shows by all the hospitals or all the agencies or all the institutes that they are accredited. That's why they are proud of it. And now we have it for the hospital accreditation and the medical and clinical institute. So what's the accreditation standards? This is when we talk about the academic accreditation now. We all know about the hospital accreditation, and it all goes around actually the patient safety and the professional healthcare provider. Now, when we go to the academic accreditation, that every institute or organization has to have the mission, vision, and strategic plan, and academic quality and institutional effectiveness integrity. This is the success of the higher education institute depends on effectively it implements to be reflected on the outcomes, and usually the outcomes are the graduates, the professional. The second standard is the leadership and governance. It talks about actually the CEO, the decision-making rules and process, the governing body, and the multi-college districts. Then the number 3 is the institutional resources, which is how this institute has get their resources, the budgets, the facility equipment, information technology, and the financial resources. Number 4, which is one of the biggest, is the student teaching and learning program and supporting services. based on evaluating two main areas, the program management and the educational effectiveness. This is when we talk about the learning outcomes. So the institute has to design and develop an academic program. The graduate attributes and learning outcomes, has to be well focused when they design the academic program. Then the academic program quality assurance and enhancement, the educational partnership, graduate programs, learning resources, teaching and student assessment. All of this is very important, and that's why when we talk about the accreditation, it's part of the assessment. بالعربي تسمى التقويم, and this is very important to know this meaning in Arabic. Assessment of the student learning outcome is to enhance the student access and improvement teaching, learning, and as integral part of good educational practice. Number 5 is the student themselves, and then we'll talk about the logistic process for them from their admission until their development, the constructive and creative innovative thinking. Standard number 6 is about the faculty and staff, the employment and retention, and the professional development themselves for the faculties, and how you support them. Definitely for them, there are many things that you need to know about is the institutional research policies, teaching staff student involvement in the research, and I think this is talking about the research and innovation, the commercialization of the research and how the research facilities and equipment and contributing to community. This is very important because again the institution is an integrated part or integral part from the community, from the labor market, from the needs of the community and development of the whole country. So we cannot work aside from what is the need from the country. And I'm talking especially about Saudi Arabia in this, I mean, the golden time that we have in development with our Vision 2030. There's a lot of efforts happened now to make the alignment between the institute or not only the universities, the school and institutes, whether university or training centers, in order to meet the requirements and make really the outcome of the learning process. It's really a valuable or a value that will be added to the community. Number 4 is the national qualification framework, which exists in Saudi Arabia, already addressed and approved. And this is talk about the knowledge, cognitive skills, and skills of dealing with the other and taking responsibility. All of this actually for all the profession that is already defined by the Ministry of the Human Resource. So all of this is already there, and everyone already has a defined knowledge and skills and attributes. And there are some details I put it for you if you like really to go through it. And then when we talk now about the accreditation and the health care outcome. Now when we talk about the international medical institutes, now there is an international organization called WFME, which is the World Federation for Medical Education. There is actually a collaboration with the WHO happened that reduce actually the outcome of this one is the commitment to quality improvement in medical education and to the patient safety. WFME actually go around the academic accreditation and to ensure that all the institutes, it's not an accrediting body, but it has to ensure that all the medical institutions getting accredited by the national approved national accrediting body in this country, in order to ensure that the graduates from the medical school they can continue their education in Canada and North America. So this is important, and the good news that we are in Saudi Arabia started with WFME, and they are coming soon for this to ensure the continuity actually of the accreditation of the medical education in the road of the patient safety. So WFME, it's a very big organization that ensured this one. I put a lot of details about their policies and how they can really ensure this one, and the agreement between them and the WHO, it's one of the best actually agreement happened in order to ensure that the graduates actually they are aware and well knowledgeable about the patient safety. One of the objectives actually of the WHO in 2016, it's the global strategy on human resource for the workforce, and now for the development of the workforce. So this is one of the important approaches that is really with me, they are participating in it. At the end, this is one of the recognition program, as I mentioned, by WFME. They are doing this one. They have a lot of the benefits that we know about it, especially if we talk about it from the perspective of patient safety, and this is started in 2015. They talk about the quality standards. They raise the standard for the basic and postgraduate medical education, continuing professional development through the publication of experts and the consensus with minimum and need of the quality standards. So we have really, as a conclusion, to say that even the accreditation, there are a lot of debate regarding the accreditation. Maybe it's only a one process. It's like a snapshot with a few days, and then everything will go back. Definitely, this is I took it from one of my colleague presentation. This is before the accreditation. This is the way that it will show. And then after the accreditation, on target, everything will be on target, which is with a low variation. Definitely there is a variation later on, but definitely it will not go back to the zero. There will be a deviation maybe from the target, but definitely it will reduce the variation. And this is one of the main benefit of the accreditation, that it reduces the gap, and then continually the gap will be more clearly identified, and there are many ways that the standard can help you to reduce the gap and the error. Definitely it will never go back to the status before the accreditation. So we still say that the accreditation, it's part of the healthcare policy, or the healthcare provider and the regulator, they are using the accreditation as part of the system to improve the patient safety and the quality, and it can provide a data to drive the decision, to allocate the budget, and this is very important, and to develop now the healthcare provider professional CPD program for them, as I mentioned, to be integrated part of the CBD to have more professional healthcare provider. I really thank you very much. I think I exceed my time by 4 minutes. I can say that really, if we talk about the academic accreditation now, and if we talk about the CBD, we need to have very clear knowledge about the patient safety standard, about all this institute. We talk about it. My colleagues who works in the medical institute, I'm sure that you are all aware about WFME. You are all aware about the WHO needed, about the patient safety competency, which is given by the Canadian Institute for the Patient Safety, or by the American Association for the Patient Safety. So all of this can really help us to have a competent patient safety champion or healthcare professional who believe really in the patient safety is an integral part of their daily work. It's not something added. It's not more documentation. It's something that everybody has really to deal with it as part of my daily task. Again, please, we will keep all the zero harm is our motto, and the patient safety is the main task for us as a healthcare provider. Again, thank you very much. I'm really happy to be with you. I wish that soon, inshallah, we will be in a live conference together. Thank you very much. Majdah Shugdar.